Sawadee and good evening. Welcome to Thai PBS World Tonight. I'm Hatay Teshakitiranan.
And I'm Nabunag, and we'll begin tonight with the latest on the restrictions. You know how people say that rules are meant to be broken, but if you break the rules, you're going to get caught for sure, especially with the curfew. And so far, police have arrested 299 people at police checkpoints for allegedly breaking the newly imposed curfew in 10 provinces between 9 p.m. last night up until 4 a.m. this morning. And that was apparently the first night that the latest stay-at-home order has been in effect. According to the police spokesman, Police Major General Yingyot Thepjamnong, 57 people were arrested in Bangkok, while 187 others were arrested in Samut Prakan, Nonthaburi, and Pathum Thani provinces, which are under the jurisdiction of Provincial Police Region 1. 7 people were also arrested in Nakhon Pathom and Samut Sakhon, which are under the Provincial Police Region 7, and 48 were arrested in the 4 southernmost provinces of Songkhla, Pattani, Yala, and Narathiwat, which are under the Provincial Police Region 9. All police officers have also been told to follow the COVID-19 preventive measures strictly, while citizens have been asked for their cooperation. Those who witness any wrongdoing can call the police hotline 191 and 1599. Up to 148 checkpoints have been set up in the 10 provinces, with 88 in Bangkok alone. Semi-lockdown measures began yesterday to curb the rising COVID-19 infections and deaths. And now let's look at the numbers for today. Thailand recorded 8,685 new cases and 56 more deaths, bringing the total infections and death toll in this current wave since April to over 324,000 and 2,753 respectively. And as we can see that most of the new infections are from local transmissions, with only 146 cases from prisons and 12 from abroad. Bangkok alone makes up about 1/3 of the infections both today and since the beginning of the latest wave in April.
And moving on now to vaccination, something that a lot of people still following up on whether or not this will be in practice and when. The mix and match vaccination practice, in which a shot of a whole virus vaccine is followed by a shot of a vector vaccine, can boost immunity, according to the prominent Thai virologist, Professor Dr. Yong Poovorawan, head of Chulalongkorn University's Center of Excellence in Clinical Virology, adding that over 30 scientists and medical experts at the center are working on 5 COVID-19 vaccine projects. It has been found that a shot of Sinovac, which is a whole virus vaccine, followed by a shot of AstraZeneca, which is a vector virus vaccine, works well in boosting immunity. The whole virus version works in a way similar to getting us infected, and it helps our bodies become familiar with the virus, he said. When injected with different kinds, such as the vector virus type, it has what is called a booster effect. And it's like when someone has recovered from a COVID-19 infection and then receives another shot, and their immunity would be boosted again. This is what the Dr. Yong said. The center has also conducted a study using the mix and match approach on the inhibition test, which can fend off the virus by an average of 95%, with some reporting 99%. He said the center is also conducting a study on the Delta variant, which is becoming more dominant in many countries, including Thailand here, and on the T-cell immunity. Dr. Yong said that the mix and match approach of Sinovac and AstraZeneca can boost immunity within 6 weeks, as opposed to 12 weeks needed for vector vaccines, and that using AstraZeneca as a third shot after 2 Sinovac shots will help achieve very high level of antibodies. And this remark of his followed Thailand's National Communicable Disease Committee's, or NCDC, decision yesterday to use the Oxford AstraZeneca vaccine as a second dose for people who have only received the first dose of China's Sinovac vaccine and as a third booster shot for medical personnel, most of whom have been fully vaccinated with Sinovac's CoronaVac, with many still getting infected by the virus. Dr. Yong also said that this approach is to help maximize the resources Thailand currently has, as now the country has only received these two types, which is the whole virus type, which is Sinovac and Sinopharm, both from China, and the vector vaccine, which is AstraZeneca, which is being locally produced here in Thailand. And Thailand has received about 14.5 million doses of Sinovac, 2 million doses of Sinopharm, and more than 7 million doses of AstraZeneca. The virologist has been under fire recently for expressing medical opinions deemed in favor of the government's vaccination campaign amid calls for the use of mRNA vaccines instead. And yesterday, the World Health Organization, or WHO's chief scientist, Soumya Swaminathan, told an online meeting the mix and match practice is a bit dangerous. We are in a data-free, evidence-free zone, it will be a chaotic situation in countries if citizens start deciding when and who will be taking a second, third, or even a fourth dose, she said. But she clarified later in a tweet last night that her comment was only meant for individuals who should not decide for themselves, while public health agencies can based on available data.
And speaking of the COVID-19 vaccines, we're still talking about the efficacy of Sinovac vaccines. Recently, there's a clinical research that has shown that the antibody levels in a person fully inoculated with 2 doses of Sinovac drops by half every 40 days. Dr. Anand Jongkawatana, a virology researcher at the National Center for Engineering and Biotechnology, or Biotech, said in his Facebook post on Monday that the research was jointly conducted by Biotech and the Clinical Research Center of the Faculty of Medicine of Thammasat University to study the antibody levels towards the RBD protein of the COVID-19 virus in 500 samples of people fully inoculated with Sinovac vaccines. The research shows the following. Firstly, their antibody levels have dropped by half over an average of 40 days. Secondly, the antibody levels of those fully inoculated after 60 days are lower than those fully inoculated for fewer than 60 days. Thirdly, the antibody levels within 60 days of the second dose are on a par with the efficacy of the vaccines against the original coronavirus variant, which is between 60 to 70% by average. But among those who are fully inoculated after 60 days, the efficacy of the vaccine dropped to 50%. Another part they also said is that there is no comparative information about the efficacy of the Sinovac vaccine after 2 doses in protection against the Alpha or Delta variants. And lastly, the level of antibodies tends to drop in line with the ages of those vaccinated, with the level of those who are over 40 lower than their peers who are under 40. Meanwhile, an actress, Thao Nattapon Temirak, said through her Instagram that she had her antibody levels checked twice, 14 days and 28 days after the second dose. She found out that the levels were a decrease. So the first one was around 1,286.4 arbitrary units per milliliter, and the second time is around 1,098.5 respectively. So we can see that there is a significant drop in the antibody levels of her. And she said that her posting about the different antibody readings is intended to remind people of the importance of protecting ourselves even after the vaccination. There's also another woman who's a wife of an actor who said that her antibody levels in the second test had dropped substantially from the result in the first test, and her tests were 20 days apart. So we can see that there is a significant drop between the first time you get tested for the antibody levels, and for the second time, you can see that there is a decrease here. So it's sort of a reminder that we still need to protect ourselves by wearing face masks, doing social distancing, even if we're fully vaccinated against COVID-19.
Definitely. And as we can see, a lot of people, even being already fully vaccinated, still getting COVID-19, and the spread continues. And speaking of the spread, there have been now more facilities for the COVID-19 test itself, and especially with the rapid antigen test, which allow you to know the result within 30 minutes. So now some good news, as COVID-19 antigen self-test kits can now be purchased for home use, according to Thailand's Public Health Ministry's announcement, which has been published in the Royal Gazette. The kits, which will be available for purchase at hospitals, health clinics, pharmacies, and other outlets approved by the country's Food and Drug Administration, enable people to test for the virus at home in order to contain the further spread of COVID-19. Government authorities which receive the test kits must deliver them to hospitals which are under government administration. Yesterday, Public Health Minister Anutin Chanvirakul announced that the National Communicable Disease Committee had already approved the use of self-test kits at 300 hospitals, which also provide verified RT-PCR tests. 24 brands of the kit have been approved by the FDA. According to Permanent Secretary of the Public Health Ministry, Dr. Poovorawan, the kits should be available in pharmacies next week. But as some of you might already have seen, the online sales of the kits have been advertised even before the Public Health Ministry's announcement was issued, with prices set at between 220 to 700 baht.
And still on the issue with the rapid testing, there have been a few places that allows the testing to be conducted, especially with the new rapid test kits. But there is one venue, which is the government complex, that also offers this type of testing, but only those with online registrations are being accepted at this COVID-19 test site, as the government complex is among a few offering free rapid antigen tests with results available within 30 minutes. And this is according to the National Health Security Office. The screening site on Dan Watana Road is open until the end of this month, July 30th, from 8 a.m. until 4 p.m., except for the weekends. Those who want to get tested must fully complete an online form. After users complete their application for registration, they will receive a text message within 1 or 2 days confirming their screening date. This is to reduce congestion at the screening sites, especially after long queues have been seen at other such locations. It is also advised that users add the NHSO COVID test line account in case they cannot register or need to request a postponement where officials can assist. Yesterday, the NHSO Secretary General Dr. Jadet Thamatat Ari said that the testing facilities implementing antigen test kits are at the Royal Thai Air Force's Thupatemi Stadium, and there's also another one at Rajamankala Stadium in Bangkapi District, and they have set a target to test up to 3,000 people per day per site. A very long queue was seen this morning in front of the Thupatemi Stadium, where all 1,500 slots for today's tests were quickly booked in just a few hours. Only 500 tests, however, will be of the rapid antigen method. The facility at the government complex will initially conduct 500 tests per day before increasing to 3,000. And there will also be a fourth facility to be located at a soccer field of the Anti-Aircraft Artillery's Division headquarters at Giakai in Bangkok's Dusit district, which will provide a free testing service tomorrow with a set target of 3,000 tests. Meanwhile, the Department of Medical Services warned the public today about fake paid bookings for COVID-19 vaccinations at Bang Sue Grand Station. It explained that on-site bookings are allowed for those over 75 years old, while others, especially those aged 60 to 74, can book their vaccinations through the mobile operators such as AIS, True, DTAC, and National Telecom.
And with ongoing tests and also infections, there have been more and more COVID-related deaths. With all the many deaths reported over the past few weeks, one may wonder if temples or cemeteries have the capacity to host funerals or cremate or bury the bodies. And as most Thai people favor cremation, it is no wonder crematoria are swamped and may be even on the verge of failure. Let's take a look at this report.
ยังไม่รู้นะครับว่าจะมาเพิ่มอีกหรือไม่สำหรับวันนี้ขนาดนี้นะครับเตาเผาศพของเรามีอาการแย่นะครับเนื่องจากความร้อนในเตาสูงมากศพที่รออยู่นี่นะครับพอเข้าไปในเตาไม่ต้องกดปุ่มหรือสวิตช์ใดๆเลยศพก็จะติดไฟขึ้นเองนี่คือความจริงครับที่เกิดขึ้น
The crematory at Rabrakong Tham Temple in Nonthaburi province is now overheated, and the temple is trying to build the backup crematory as quickly as possible. Pairat said the temple has organized over 100 funerals for free around the clock since May. The temple and the foundation run on donated money. They have a project called The Last Home, organizing funerals for poor people for the last 6 years. The temple provides everything, including the coffin. The temple uses at least 250 liters of diesel per day. The foundation is spending about 40,000 baht a day to facilitate its services. The non-stop cremations means that the crematory is sometimes inoperable for hours because of the overheating problem causing a backlog.
พฤษภาคมเนี่ย5 ศพ 6 ศพเผาได้แต่ตอนนี้เราสู้ไม่ไหวเตาเราแย่ได้วันหนึ่ง3 ศพ 4 ศพนี่ต้องถึงประมาณตี 2ถ้า4 ศพนะแต่ถ้าเกิดศพมาถึงเราแล้วเราก็ต้องทำตี 2 ตี 3เราต้องทำ
It is a similar situation at Sao Thong Hin Temple in the same province, which has been providing services for COVID-19 victims. The crematory here is also on the verge of being broken down. Some of their days finish at 3 in the morning. The temple is on standby 24/7 to organize funerals. They are working at full capacity and are planning to hand bodies of the victims over to other places if they cannot handle the situation.
ศพมาตอนไหนอาตมาภาพทำให้ทุกศพครับศพเมื่อวันพระเมื่อวันโกนที่ผ่านมานะครับคุณโยมศพมาถึงวัดเสาธงหิน 23 นาฬิกาแล้วฝ่ายทำพิธีการสวดพิธรรมศพชาปนกิจศพก็6 ทุ่มเริ่มเผา6 ทุ่มเสร็จประมาณตี 3นะคุณโยมครับ
To provide free services to the COVID-19 victims, these temples and foundations are accepting donations, whether it is cash or other necessities, such as PPE suits or diesel fuel. Though the National Office of Buddhism allows temples to request funds for COVID-19 related funerals, temples have to write a proposal in advance. Not every temple accepts the bodies of COVID-19 victims, so the ones that do are doing the best they can to cope with the situation.
Moving on, the Food and Drug Administration is expected to approve the registration of the locally produced Favipiravir antiviral medication this month to be used in the treatment of COVID-19 patients. And this is according to the Deputy Government Spokesperson Rachada Thanadirak today. She said that research and development of local raw materials to produce precursor ingredients needed to make this antiviral medication jointly undertaken by the National Science and Technology Development Agency, the Government Pharmaceutical Organization, and PTT Public Company have been progressing well. The corporation also covers laboratory scale trials, technology transfer up to industrial production level, and feasibility studies of commercial development of the active pharmaceutical ingredients. adding that this is a model of cooperation between the private and public sectors in the development of Thailand's pharmaceutical industry. Dr. Rashida said that the lab is capable of producing API from local materials for production of Favipiravir tablets on a commercial scale, which will cut the cost of import of the precursor ingredients, which now accounts for 95%. Currently, the GPO is importing Favipiravir from Japan at a cost of between 117 to 120 baht per tablet, but it is estimated that locally produced equivalents will be priced at between 30 to 40 baht per tablet, according to the GPO. She went on to say that the development of COVID-19 vaccines by Thai researchers is also progressing satisfactorily, demonstrating the capability of the Thai medical and health systems, which in the long term will reduce Thailand's dependence on pharmaceutical imports. She also noted that Prime Minister General Prayut Chan-o-cha has been keeping close watch on the development and the production of this medication, which is part of the government's Biocircular Green Economy, or the BCG strategy.
And it's time now, this time of the week, where we have our startup series. And in this episode, we take a look at Fling, a startup which provides software development for drone flight, which is becoming more and more popular in Thailand and around the world, especially in light of accelerating digital transformation when fewer things are done physically or face-to-face because of the pandemic. Let's now take a look at my interview with the CEO of this startup. When you hear about Fling, you may think about whirlwind romance, but we're talking about something which is perhaps even more exciting. We're talking about throwing yourself headlong into drone technology, which is used for more tasks than you might imagine. Founded in July 2018, Fling offers venture-backed software and services for drone flight. Fling's drones have flown thousands of kilometers, with the main focus being on inspection of electrical transmission lines in warehouses, while also venturing into delivery services, with trials conducted on delivery of automated external defibrillators, or AEDs, medical parts, pharmaceuticals, e-commerce packages, and ready-made food. Just imagine having food delivered to your home by drone. Although that is still in the pioneering phase, it will cost as little as 50 baht to deliver within 5 kilometers in just 5 minutes. You won't have to check where your food is in Bangkok anymore. Full expansion of delivery services in the capital is expected next year. Headquartered in Bangkok with a distributed development team in Europe and North America, Fling has a team of over 20 people working in engineering, business development, and marketing. I talked to Fling CEO Michael Curry about the idea behind his startup and about what the company is up to.
The founding vision of Fling, I was in traffic in Bangkok, and it was a lot of traffic. I couldn't get anywhere. We were stuck, and I looked up in the sky, and there were some birds flying around, free and easy, just flying. And I realized, wouldn't it be great if we could use this three-dimensional space that's all around us to get around? And from there, I really wanted to take that vision and introduce a drone delivery for packages, at least, maybe not people quite yet, but for packages in Bangkok. What we've discovered over the last 3 years of working with drones is that there's a lot more that they can do than simply the B2C or business to customer vision of drones actually carrying packages, but in fact really can be the leading edge of digital transformation for businesses that are seeking to increase efficiency. We have a whole variety of clients, mostly in Thailand. Some of the largest corporates and state enterprises here in Thailand work with us to introduce drones into their work process so that they can achieve those efficiencies and really take advantage of the data that you can capture from drones that's not possible to do without them.
Among his clients are the Electricity Generating Authority of Thailand, or EGAT, the Digital Economy Promotion Agency, or DEPA, and real estate developer Sansiri. The company's platform called Fling AI is used as a main tool, but there are additional modules for his clients' specific needs.
We run this enterprise drone digital insights platform called Fling AI, and this platform allows customers to run their own flights with their own drones. So it's true that for some specialized missions like drone delivery, we actually have our own pilots and our own drones flying the missions. But our digital platform actually empowers workers who know their assets best and who really are out in the field, perhaps in other provinces in Thailand. They're able to fly their own drones, and they can do this autonomously with our platform. We found a large need for inspecting, for example, racks very high up in a warehouse, difficult for workers to access. They have to use forklifts, and it's dangerous to go up so high. So with our drones, they can fly these missions and take pictures and do a stock check for their inventory autonomously without any intervention by that worker.
Working closely with the Civil Aviation Authority of Thailand while noting some challenges the government's type regulations have over drone flying. Separate permits are required for camera drones and drone pilots. Insurance is needed and specified altitudes and areas imposed. Mr. Curry is in support of such laws for the sake of safety and security.
Certainly around the world, governments are very reluctant to allow drones to be flying right in the urban areas around people. And I think this is something that will be a concern, going forward as well. This is not something that is going to change anytime soon. Of course, these drones are very powerful in the sense that they can take pictures and they can, violate people's privacy very easily. So we actually at Fling, we're very big believers in regulation and strong regulation of drones, so that the good use cases of drones can be allowed, and the bad actors or the people who are up to no good or maybe just irresponsible, really we feel that those people should be prosecuted and should be restricted from conducting their drone activities.
Unlike many businesses, but like most other tech startups, Fling remains largely unaffected by the pandemic, with some minor challenges over the lack of face-to-face business interactions, but with peaked interest in the use of drones.
Without those physical meetings, it really is hard to form those human relationships that it takes and develop that trust that's necessary for succeeding in business. And yet what I'm seeing is over the last year or so, there's been a change in the culture around the world, I think, and especially in the business culture here, for tolerance for forming a relationship over Zoom, closing a deal over Zoom. Industries we're working in, actually, those industries are rather unaffected by COVID. In fact, with the concern for human contact, drone delivery is actually something people are more interested in than they were before COVID. These types of innovations are actually good in the context of COVID. And of course, during COVID, everyone's using electricity, even more probably because we're all using our air conditioning at home. And so again, the customers that we work with are, in fact, unaffected by COVID, and therefore, in fact, this has been not a major issue for us.
Optimistic that the trend of digital transformation is here to stay and growing, Mr. Curry envisions that the use of drones will become the norm in Thailand and that his business will grow.
I think there's a lot of excitement around drone technology and artificial intelligence technology. I don't see any signs of it lessening or abating. I see there's still so much scope for large enterprises to take advantage of this technology. With digital transformation, there's the possibility of lowering costs by 20 or 30% sometimes, and this could be absolutely the largest driver of profitability for a company.
Hatay Teshikitiranan reporting for Thai PBS World. And And with that, we wraps up tonight's program. Don't forget to catch us on Facebook, Instagram, YouTube, Twitter, TikTok, and our website, www.thaipbsworld.com for all the latest updates.
Thanks for watching. Stay safe, and we'll see you tomorrow. สวัสดีค่ะ
สวัสดีค่ะ